Good morning, all of you. I'm Dr. Shalini Singh. I'm presenting my topic, comparative clinical trial of intracameral ropivacaine versus lignocaine in subjects undergoing phacoemulsification under augmented topical anesthesia. I have nil financial disclosure. Phacoemulsification under topical anesthesia is one of the most popular method of cataract removal currently. Augmentation of topical anesthesia with intracameral anesthesia makes surgery less painful with better patient comfort. Lignocaine and ropivacaine can be used as an intracameral agent. The purpose of our study is to compare the safety and efficacy of intracameral ropivacaine 0.1% to lignocaine 1% in patients undergoing phacoemulsification under augmented topical anesthesia for uncomplicated senile cataract. Method, this was the prospective randomized double mask clinical trial. Subjects were planned for phacoemulsification under augmented topical anesthesia. The patients taken were having visually significant uncomplicated senile cataract. Patients were randomized into two groups. Group A consists of ropivacaine 0.1% and group B was consisting of ropivacaine lignocaine 1%. Patients were evaluated for pain experienced during the surgery, mydriasis, post-operative inflammation, and endothelial cell change at 6 weeks after surgery. Pain was evaluated, and the patient for pain evaluation, patients were instructed to inform verbally about any discomfort or pain during that step of the surgery instantly. And at the end of the surgery, visual analog score was given to the patient to report their pain experience by making an appropriate point. This was the visual analog score. Pre-operative mydriasis was done by 0.8% tropicamide and 5% phenylephrine eye drops. Intracameral injections was also given and the mydriasis was also noted down after intracameral injections. Post-operative inflammation was noted on the basis of standardization of uveitis nomenclature and patients were graded accordingly. For endothelial cell change, specular microscopy photographs were taken by Conan SP 8000 specular microscope, and endothelial cell density was noted at the time of the surgery and after 6 weeks after surgery. For surgeons' feedback, a questionnaires were also prepared, and the points taken in questionnaires were patient cooperation, difficulty due to ocular movements, and anterior chamber stability. Complication during the surgery was also noted down, and if there was any complication present, then that patient was excluded from the surgery. Pre-operative pupillary dilatation and dilatation of pupil after intracameral injection was also noted down. Total sample size taken was 210. Around 26 patients were excluded. So 184 patients were randomized into two groups. Group A was given ropivacaine 0.1% and group B was given lignocaine 1%. 2 patients lost to follow-up in group A and 3 patients in group B. So total analyzed patient in group A were 90 and in group B were 89. Results showed no statistical significant difference in between two groups on age, painful surgical steps, visual analog scale score, surgeon's score, post-operative inflammation, and average ultrasound time during phacoemulsification. However, the group A patients fare far better than group B on endothelial cell loss and augmentation in mydriasis. It compares the efficacy and safety of intracameral ropivacaine 0.1% to lignocaine 1% under augmented topical anesthesia for first time. It shows that intracameral ropivacaine and lignocaine both are equally effective in providing analgesia during phacoemulsification. However, intracameral ropivacaine is superior to corneal endothelial safety and augmenting mydriasis than lignocaine.
You have not mentioned anything about the systemic effects, especially if you're giving it both topically and all these local anesthetics. We need to know the systemic toxicity. Is it more or less? And what are the literature say?
Ma'am, actually,
this has been used in other fields, isn't it? It's not just ours.
Yes, ma'am. So I have used only 0.2 ml of intracameral injection, 0.2 ml of intracameral, 1% lignocaine was given, and 0.1%.
I know, whatever the dose, because you're directly, once it's in an open eye, the absorption is quite a bit. And systemic toxicity is you need to monitor, and also the duration of the analgesia. What was its effect? Because these were used for its better duration. I mean, this newer anesthetic, ropivacaine, is
Yes,
in the rest of the fields, surgical fields, it is about duration of the analgesia. But did we see that? And because that would be giving an added advantage, I am not sure. We should mention that.
Can I have one
Sir.
question?
Yes, sir.
Yes, sir.
Any case of PCR, just to know that it goes into the vitreous cavity or cause any posterior segment problem also?
Sir, actually, we have excluded that patient from the study. We treated that patient according for rest of the cases, but we only included the patient that have uncomplicated surgery. So we have not taken that into study.
Knowledge, just for our knowledge.
No, sir, no patients were
How
there.
do you explain, one more question, last one. How do you explain this sustained mydriasis? Was it endpoint you measured? Is it known in to cause? That's an important advantage to my mind.
Ma'am, we have measured the preoperative when patient came to table. So we measured the mydriasis, and we measured the mydriasis just after intracameral
What is the
injection.
explanation? Is it a freak one, or does it have some kind of steroidal effect or what?
Ma'am, it has a long-acting effect, so we can expect the effect to be there for a longer time than lignocaine, ma'am. So this new drug is more similar to bupivacaine, not like lignocaine. It's long-acting, ma'am.
That's what we have seen the duration.